Yaoundé yesterday. So what is this global adult tobacco survey all about?
Okay, I'll come back to correct something, which is clear. I'm campaign officer for the Cameroon Coalition to Counter Tobacco.
Okay.
Yeah, which is a non-for-profit organization created way back 2006 to save Cameroonians, present and future, from tobacco-related diseases. And the Global Adult Tobacco Survey was the first of its kind that was conducted in 2013 in Cameroon. It is the first really advanced standard standard technology used, because you know there are other surveys, but concerning health, this is the first survey that had this kind of technology being used, because when we talk about tobacco use, it's a global issue. So this survey was conducted by the National Institute of Statistics and under the coordination of the Ministry of Public Health.
And what did the survey reveal?
Yeah, this survey that was conducted using households. So it was actually a household survey of persons 15 years and old. So this survey having 15 years and old persons, we had actually 5,710 households who were supposed to be, which we had to select one individual randomly from this household. And the respondent, we had 5,271 persons who responded, and we have a response rate of 94.1%, which means that so many people actually accepted to respond to this survey, to know what tobacco use is around adults. Because yesterday, just to say that focus was on the global youth tobacco survey, because the global tobacco surveillance system is a measure which is put internationally to coordinate and evaluate the implementation of this World Health Organization Framework Convention on Tobacco Control, which is also empowered by Empower, which M stands for monitoring tobacco use and policies, P stands for protecting people from tobacco use, O stands for...
Okay, now you're just mixing my head and boxing everything up. I wanted you break it down and bring it quite easy. Why focus on tobacco in adults?
Focus in adults because this survey will help provide evidence. Today we know that tobacco kills, but we need more evidence to implement this framework convention on tobacco control, because you know it's a treaty that Cameroon decided to sign in 2006, and since 2006 we need a tobacco control law in Cameroon, because every country that decides to sign this treaty has a very limited time to have a tobacco control law.
And when you imagine the tobacco control law is instituted, how does it work? Because when you even take a packet of cigarette, it's written there, you don't, minus 18, right? But you have people who, you have adults who, you have 12, 10, 14 buying that. So what is the importance of putting, you don't consume tobacco if you're less than 18, but people still go in and buy. So how is it even controlled at the end of the day?
Yeah, actually what is happening is that these laws are there, but they are not really implemented. We don't have strict measures to follow up because we don't have a law. These measures are just international measures put in place by the World Health Organization, but now we need to adapt them to our own country realities. That is why we need to carry out surveys like the Global Adult Tobacco Survey to tell people that more than 80.4 people want tobacco to be eradicated from indoor public places. You see, this to talk about cessation. People want tobacco not to exist in public places. Some people don't know even that tobacco causes some diseases like cancer, diabetes, and what have you. So this survey is actually...
And the fact that tobacco, if someone smokes next to you, it's like you were smoking too.
Yeah, smokers are patient, and secondhand smokers are their followers, so they are also patient. So if you're smoking, you are a patient. That's what people don't know. It's not because you're a minister, you're a farmer. Everybody smoking is a patient. And secondhand smoking revealed that there are really so many people who are exposed to secondhand smoking. For example, it's classified with respect to the milieu. For example, we can have more than 19 2.2% of people working, like you're working here in CRTV, adults are exposed. This amount is going up to about 400,000 people. And the highest is in bar and nightclubs, where we have more than 3.6 million people exposed to tobacco smoke. And when we talk, some people don't understand how tobacco use functions. We have tobacco in its smoking form and smokeless form. So
how do you what's the difference, smoking form and smokeless form?
Yeah, smoking form is cigarette itself, any form that gives out when you take in you smoke, it gives out smoke where people can inhale.
Okay.
Yeah, but we have the smokeless form is the snuff, which statistics show that in Cameroon only 2.2% of adults use
the
this.
Snuff, the one inserted in the nostrils.
Yeah.
That's
and
smoking too.
No, it's
a smokeless.
It's smokeless.
Yeah.
When you look generally, it's not smoke. There is no smoke coming out. Even the one they put in the teeth, every form of it, which does not bring out smoke. And the statistic shows that in Cameroon, 2.2% of adult males use this. Meanwhile, women, more than 3.8% use it. So women consume more smokeless. Tobacco than men. Meanwhile, men consume smoking cigarette than women.
Okay, what I want to understand is the smokeless or the smoking form of it, it has the same consequences on the human system.
Yeah, because tobacco affects every part of the body, every part of the system of the organism. There is no part of the body that tobacco does not affect. So those who are cultivating tobacco are exposed, just cultivating, even without smoking. Because the constituent of tobacco is nicotine, and nicotine is found in the plant itself, and anybody in contact with it, either in its refined form, in its cigarette form, or just the natural form, you're still exposed.
How can you be exposed to it if you were just a farmer, if you're just doing that, if you're just planting?
If you're just planting, nicotine is, we are talking about vegetals, and when we look our skin tissue, getting in contact with a vegetal that has nicotine, it destroys our skin tissue. Yeah, that's what's happening. You see your hands very soon, it starts eating you up, and it gets inside. So it's not only about you smoking, but when you're in contact with the leaves and planting, when you work, you follow up the procedure, you're exposed to always being in contact with this plant that contains nicotine.
So what you're trying to tell us today is that be you just somebody who plants nicotine or someone who smokes it, we all have the same consequences to our systems.
Yeah, we have the same consequences.
Okay, what I want to know, when you're someone who smokes cigarette, you say there are patients, and then you say the others that inhale at the side are what? They are
patients, they are follower patients, because they are not smoking directly. That's why we call them.
But they inhale.
They inhale.
All right. And those who take the smokeless form of tobacco, that is inserting in the nostrils, putting on the tongue, and stuff like that. But those around them are exposed to nothing, right?
For sure. That is why when we look at the numbers in terms of expositions, that's why our focus today is to make people to understand that secondhand smoke is very dangerous. So you're actually a smoker but not putting it in your mouth. But the other form of it, which is smokeless, the person is exposing him or herself alone. It's not a transmissible disease. These are non-communicable diseases which are non-transmissible. So it's actually your personal issue. But today, this is when we really bring a differentiation, is to make people to understand that today we focus so much on malaria, HIV and AIDS, tuberculosis, but tobacco-related diseases kill more than these other diseases all combined. These are statistics which are already revealed, and in some countries like Kenya, people are already diverting research from HIV to non-communicable diseases, because if we are fighting something, when we'll be done with HIV and AIDS, there will be something showing up. And when we look the number, the age group statistics globally show that 80% of people who smoke today started before the age of 18. It means that if concrete action is not taken, more than 250 million children and young people would die in the upcoming years. So this is to say that the figures are there. The tobacco industry knows what is happening, and these statistics from the Global Adult Tobacco Survey, which actually points out the fact that if you notice very well, 3 in 10 adults want tobacco to be eradicated from all public places.
But it doesn't stop them from smoking. What makes you think is the push behind that?
There are diverse reasons for smoking, some personal, but we need to understand one thing. The vector of tobacco is the tobacco industry. So there is somewhere, that is where it starts. In Africa, we were never smoking till colonization came. And you have to understand that with colonization, we are still going to be suffering, and tobacco use is one of the effects of the consequences of colonization, because we were forced to use certain things just for pleasure. There is nothing. I ask people sometimes, why will you smoke? Because I don't think about the person smoking.
Okay.
The person who is not smoking, why will you start smoking? Most of them tell me, if I have a problem, today I'm okay, but if tomorrow, if there is something shows up, I'm going to smoke.
Okay. And I'll put this question to you, because you are the campaign officer for that, and you should surely know more about tobacco. If you go to some parts of the northwest region of Cameroon, and we go to some villages, let me break it down to Bali. There are some grandmothers there, 70, 80, they continuously smoke, and you see them strong and healthy. And the moment they tell them, okay, you go to hospital, and you're like, no, you should have to stop smoking, and it's not good for your health, it's going to make you going to die even before you ever believe. You're going to have a whole lot of other sicknesses that will add to your skin and stuff like that. When they stop for 2 days, you see them acting like they are next to the grave. But the moment they take it back, they act strong. What accounts for that?
I'm going to answer this question in two directions. Not like a medical doctor, because I'm not. But when we smoke, there is what we call addiction. Their system is, as a biologist, I know our systems are different. And tobacco use adapts to our system. So when I continuously use nicotine, statistics show that those who smoke, their life expectancy will be reduced to 15 years. So it's not because that grandma is 80. Maybe she was supposed to live at 110 or 120, and if she has to die at maybe 90,
yeah,
it's still the contribution of tobacco. But the difference is that your question really comes back to our different systems. It doesn't mean that everybody is going to be affected with tobacco in the same way, because the difference is that grandma is smoking something which I will not justify that is good to be smoking, which is in its natural form, but still dangerous. But if we look, the tobacco industry is modifying. We have quota, what they used to make our roads in. We have more than 4,000 chemicals which are dangerous to the health put in cigarette. So this is, and the tobacco industry confirms by writing on the cigarette seriously damages your health and that of your neighbors. Why do they write this if it's not true? They write it, but the tobacco industry for years have been manipulating those who are ignorant. In Africa and many low-income countries, is because we don't know that tobacco kills, and the tobacco industry is continuing to do its promotion.
And what is the setback for Cameroon instituting a law to protect that?
The setback will be protecting present and future generations, because actually during the World Conference on Tobacco or Health, which is the biggest conference that brings around more than 30,000 delegates to evaluate the progress and the barriers we are facing on tobacco control in the world, Cameroon will take a bold step by completely banning tobacco use in Cameroon, which is already done in some countries like Uganda. They have the strongest tobacco control law. Neighboring Nigeria, they have a tobacco control law, which means that Cameroon will just be standing out in the Central African sub-region to make the difference.
Okay, thank you very